Welcome back to The Broken Shift. My name is Natalie, and we're going to get right into this. Hit that like button, subscribe, and hit that notification bell so that you can be notified the next time I upload a video. And today, we're talking about statins. Yeah, statins. I was just in a nursing subreddit, and there was a nurse asking this question about statins. She said that she's had multiple patients recently that came to her and said they didn't want to take the cholesterol medicine because their cholesterol medicine, they heard, can cause dementia. Drop me a comment if you are a nurse and you've heard this, or if you're a patient and you're on cholesterol medication and you have heard this. So let's debunk this, right? Let's talk about this, because statins are known to be preventative, right? They prevent patients from having strokes. They prevent patients from having heart attacks, cardiac events. It's been revolutionary in helping patients. Obviously, some patients can't take statins for multiple reasons, because one of the side effects of statins is cramping. So a lot of patients get cramping and then they have to take something else. But I want to debunk this. So I did a little bit of research to see what studies I could find that link statins to dementia. And from what I can find, there's no scientific evidence that supports the claim that cholesterol medication causes dementia. And in fact, many large-scale studies suggest a protective effect. There are some peer-reviewed articles that also have reported a potential link or have raised concerns. So these studies are often smaller, observational, or consist of case reports, and their findings are subject to ongoing scientific discussion. So they're not conclusive, just so you know. But there are some smaller studies out there that have linked it to a potential risk. Those studies are not large enough to say, yes, it causes dementia. The conversation around cholesterol and dementia primarily revolves around a class of drugs called statins. So if you are on a statin, you can do a search online, talk to your doctor, and find out if the medication that you're taking for your cholesterol is a statin. This is not medical advice. This is for informational and educational purposes only. Any medications you take or don't take should be discussed with your primary healthcare provider. So here's a look at the types of peer-reviewed literature that have suggested a potential negative impact on your cognitive health. So there was an observational study with conflicting results. While many large-scale observational studies show a reduced risk of dementia with statin use, some have produced conflicting findings or have suggested a risk in specific populations. For instance, some studies have noted that the type of statin may matter. So, lipophilic statins, for example, atorvastatin, simvastatin, which can more easily cross the blood-brain barrier, have been the focus of some research suggesting a potential for cognitive side effects. One area of investigation has been in patients with pre-existing mild cognitive impairment. So, some studies have suggested that in this specific group, the use of lipophilic statins might be associated with a higher risk of progressing dementia. However, these findings are not universally confirmed and are often contrasted by other studies showing no such effect. There are numerous published case studies and case series in medical journals detailing individual patients' experiences of cognitive impairment, including memory loss, confusion, while taking statins. A notable characteristic of these reports is that these cognitive symptoms were often reversible upon discontinuing the use of statin medication. While these reports are valuable for raising awareness of potential side effects, they do not establish a causal relationship due to the small number of patients and the lack of a control group. Because the study was so small, there's no way for them to say for sure that without taking the statin, these patients wouldn't have experienced dementia anyway. It's crucial to contextualize these findings with a broader landscape of scientific research, which we don't have right now. So at this point, there is no strong evidence to suggest that statins cause dementia. Now, we're going to talk about the potential protective effects. Many studies indicate that statin use is associated with a reduced risk of developing dementia, including Alzheimer's disease. The proposed mechanism for this protective effect include improved cardiovascular health, reduced inflammation, and antioxidant effect. Obviously, with improved cardiovascular health, you have better oxygenation and reduced risk of dementia and cognitive impairment. The Food and Drug Administration does acknowledge a rare post-marketing report of cognitive side effects with statins, such as memory loss and confusion. However, the FDA notes that these side effects are generally not serious and are reversible upon stopping statins. Right now, these peer-reviewed journals that I found really do not support this hypothesis that cholesterol medications causes dementia. But if you are concerned for individuals who cannot take statins or who need additional cholesterol lowering medication, there are several alternatives available. Each class of drugs works differently to manage cholesterol levels and comes with its own set of pros and cons. So here's a look at the options and how they compare to statins. So the first line of defense are the statins. The statins are typically the first choice of medication for high cholesterol. They are highly effective at lowering LDL, which is the bad cholesterol, and have proven track record of reducing the risk of heart attack and stroke. How they work? Statins block an enzyme in the liver called HMG-CoA reductase, which is essential for producing cholesterol. This action lowers the amount of cholesterol circulating in the blood. The pros: it's highly effective in reducing LDL cholesterol by 30 to 50% or more. Extensive research demonstrates their ability to prevent cardiovascular events, generally well tolerated by most people and available in affordable generic form. Some of the cons: it can cause side effects, most commonly muscle pain, weakness, while severe. Although muscle damage, rhabdomyolysis is rare, milder aches are more frequent. Some people may experience digestive issues or an increase in liver enzymes and a slight increase risk of developing type 2 diabetes has been observed in some individuals. And rarely, cognitive effects like memory loss or confusion have been reported, which are typically reversible upon stopping the medication. So what are the alternatives if you can't take a statin? Here's one. Ezetimibe is a commonly used alternative or add-on to statins. How it works? It works in the small intestines to block the absorption of cholesterol from food. The pros are it effectively lowers cholesterol, though typically less than the statins, around 15 to 20%. It can be combined with a statin for a greater cholesterol lowering effect and generally has few side effects. The cons are it's not as potent as a statin in lowering LDL cholesterol on its own, and it has possible side effects including diarrhea, fatigue, and joint pain, though these are uncommon. The next one is a PCSK9 inhibitor. This is a newer and very powerful class of injectable medications. How they work? These PCSK9 inhibitors are monoclonal antibodies that block a protein called PCSK9. By blocking this protein, more LDL receptors are available on the liver to remove LDL cholesterol from the blood. The pros: this is an extremely effective treatment capable of lowering LDL cholesterol by 50 to 60% or even more. It's a good option with individuals with familial hypercholesterolemia, a genetic condition caused by very high cholesterol, or those who cannot tolerate statins. It's administered as an injection every 2 to 4 weeks or even less frequently with newer formulations. Cons: it's significantly more expensive than statins. It requires self-injection, which can be a barrier for some patients, and it has a potential side effect including injection site reactions and flu-like symptoms. Another one is bempedoic acid. Bempedoic acid is a newer oral medication that can be an alternative for those who experience muscle-related side effects from statins. How it works? Similar to statins, it blocks an enzyme involved in cholesterol production in the liver, but it acts as an earlier step in the pathway. It is activated in the liver, not in the muscle, which may explain the lower risk of muscle-related side effects. The pros: it lowers LDL cholesterol by 15 to 25%. It's a good option for patients who are statin intolerant due to muscle pain, and it can be used in combination with other cholesterol-lowering drugs. The cons: it can increase uric acid levels, which may lead to gout in susceptible individuals. And it has a potential for tendon rupture, although this is a rare side effect. The next one is bile acid sequestrants. This is an older class of cholesterol-lowering medication. And how do they work? These drugs bind to bile acids in the intestine, preventing their reabsorption. The liver then uses cholesterol to make more bile acid, which lowers the amount of cholesterol in the blood. Pros: it can effectively lower cholesterol levels. They are not absorbed in the bloodstream, which can be an advantage for some patients. And the cons are: it can cause gastrointestinal side effects and constipation, bloating, and gas. It may interfere with the absorption of other medications and fat-soluble vitamins, and can sometimes increase triglyceride levels. Fibrates are primarily used to address high triglycerides, another type of fat in the blood. How they work: fibrates are most effective at lowering triglycerides and can also modestly raise good cholesterol, your HDL. Their effect on LDL cholesterol is variable. So the pros are: it's very effective in lowering high triglycerides and can provide a small boost in your HDL cholesterol. The cons is this is not a primary treatment for high LDL cholesterol. So it can have a side effect including upset stomach and gallstones. It can increase the risk of muscle problems when used in combination with statins. Next, we have niacin. Niacin, or vitamin B3, can be used in prescription strength doses to manage cholesterol. How it works: niacin can lower triglycerides, LDL cholesterol, while raising HDL cholesterol. The pros: it's effective in raising HDL cholesterol and can also lower triglycerides. The cons: it commonly causes uncomfortable flushing of the skin. So you're gonna feel like maybe like your face is getting hot. You'll get a flush. It will pass. It can also cause stomach upset at very high doses and may increase the risk of liver problems and high blood sugar. Its use has declined due to the side effects and the availability of more effective and better tolerated medications. So those are the differences. I just wanted to give you a whole realm of options to discuss with your provider. There's really no correlation between dementia and statins, but if you are on a statin and you notice that you're having some issues, discuss with your doctor and see if any of these other drugs might be more effective for you. All right. Drop me a comment if you enjoyed this content, and leave me a comment and let me know if there's anything else that you would like to see me talk about here. I'll be doing occasional topics like this on the Broken Shift, because after all, health is wealth. Thank you for joining me on the Broken Shift, and I will see you in the next one. Love you. Bye.